So in my previous video, I talked about only way not to have a heart attack in India, and anybody risk increases after age 40, keeps increasing, and in late 50s, 60s, 70s, risk of heart attack and cancer also. These are two things which dominate our mind. Very honest, diabetes, blood pressure, everybody seems to have it, and I would not consider them so-called disease. No, they are part of the aging. Just like we start using our reading glasses uh, somewhere in our 50s, all of us need reading glasses. And this is not exactly aging. Our hair start turning white. This is not a disease. This is just part of the aging. I will consider these days diabetes and blood pressure part of the aging, and they need a years and years of management once we have them, and they can be very well managed with the medicine. There is no risk of sudden death uh, from the diabetes or blood pressure. But when it comes to the heart, there is a sudden risk of death. When it comes to the cancer, if there is a risk of premature death if we do not diagnose it in time. We may die within months and years, depending upon the stage of the cancer. So, so now only way not to have a heart attack in India, or best answer is to know that we are going to have a heart attack. How do we know? There are three simple tests. We are doing it. We doctors are doing it. Even my colleagues in India are doing it. In Delhi are doing it. My wife has done it. Once we have done these. So let me tell you about the one test. I will tell you one test every day. These are simple tests, non-invasive tests. They do not cost that much. Not in a prosperous middle class society community today. So, so first test is what I will call is the EKG or ECG, which costs around 200 rupees to you, and it tells us all about the electrical function of the heart. Electrical function is very important. If heart's beat irregularly, it cannot pump blood effectively. For it to function well, it has to contract, relax, and there are two electrical switches in our heart, and they work in a coordination, in a rhythm, and the blood flows. As heart contracts in a particular direction, and it goes to the brain, and eventually goes to the lungs, get clean, comes back, and then goes to rest of the body. So, but electrical function, one thing very unique about heart is if you take the heart out of the bodies, I've seen it. I've been part of the one time I was part of a heart transplant, so it beats by itself. I mean, we used to do experiments in frogs, and you take the heart out. As long as you provide it oxygen and fluid and dissolved oxygen, it keeps beating by itself. So that is the first test. I will tell you every day. Next day, tomorrow, I will tell you about the second test. Day after tomorrow, I will tell you about the third test. If you do these three tests and they are all fine, then you cannot have a heart attack for next 5 years. Thank you.